We're only halfway through the year and Toronto has already seen 7 confirmed cases of the measles. That's according to Toronto Public Health. Now that may not seem like a lot, but consider that last year there were 10 cases in total. It's taken a lot of time and effort to keep the virus at bay, and health officials say they're going to need the province's help to ease the burden. It's a measles response effort that has so far cost the city $750,000 this year. But according to Board of Health Chair Chris Moyes, it's been working.
That's the cost of preventative medicine, right? Is making sure people are aware.
The city is now asking the Provincial Ministry of Health for 2 things. The first is help combating vaccine misinformation. According to provincial public health data, measles vaccination rates in Toronto have fallen since the pandemic, specifically among those aged 7 years old. Officials say vaccine hesitancy plays a considerable role.
Well, since COVID-19, there's been a growing number of misinformation and disinformation groups out there, especially in social media, that tell people not to get vaccinated. We've done our part at the city, but I think we need a provincial strategy, if not a national strategy, to really keep people informed.
The second ask is not a new one, an electronic provincial vaccine registry.
It just needs political will on behalf of the province to do so. Because right now it's a piecemeal approach. We have to ask the schools or ask the physicians, ask public health, as to who has what vaccines.
In a statement to City News, a spokesperson for Ontario Health Minister Sylvia Jones said public health units already use a central database to record routine vaccinations, adding, quote, "We are modernizing the provincial electronic health record to provide Ontario residents with a digital identity tool to access their personal health information, including medical and vaccination records." The statement also noted the government's, quote, multi-million-dollar province-wide marketing campaign to raise awareness of the risks of measles and how it can be prevented through the vaccine, safe, available, and free to all Ontarians. In the meantime, Toronto Public Health has begun sending out letters to roughly 140,000 public school students with incomplete measles vaccination records, encouraging them to get vaccinated and report back to the health unit. For City News, I'm Erica Natividad.